And joining us is a fighter and doctor that comes with insights in the world of medicine, and I also say this as a son of a doctor. It actually doesn't sound that bad. Dr. Zamir, hello to you.
Hello, Nathan.
Have you ever had a moment in your life, a groundbreaking moment, that caused you to rethink and to search a new path in your knowledge about the world of medicine?
There were quite a few moments like that were the reason why I moved to alternative medicine. The big shock I got was when my father, R.I.P., laid on his deathbed in a hospital in Russia. It was revealed to me that he was given morphine, and the only reason why one would give morphine is in order to draw closer to the end of someone's life. I was even more shocked to find that this was done by doctors.
You understood that the doctors are contemplating the shortening of the life of your father? Whether intentionally or unintentionally, it is not something which we will argue on now. But one thing is agreeable. It is a drug that brings the end closer.
Today it is also common that a person who suffers from a terminal illness, with or without pains, there is a good chance that eventually they will give that patient that does not have a chance to leave the hospital in the near future, they will give him morphine.
And did your father have a chance?
Yes. If they had told me that they can't treat his illness, since he had a blood disease that was getting worse, but he could have lived longer.
And would they have told you then?
I would have gone into action. First, there is a professor that knows how to treat that disease. And second, I would have transferred him to a different hospital. I would have turned the world upside down. I ran to the hospital, but it was too late. I was informed that he had already died.
Do you miss him? Does it make you upset?
Of course I miss him. And I'm disgusted every time anew.
And your longing for your father takes you to a new path, and this path today brings a lot of alternative tools that improve the lives of other people. Can you give me an example of an area where this works?
First, I wrote a book after a few years of research, investigating and checking. The result is an investigative book which exposes the system, but I don't know if it helped anyone. With this in mind, I went to work in the field of alternative medicine and homeopathy. I learned a lot from life.
Can you give any advice that can help people at home? For example, a person that's, let's say, suffers from being overweight, that you can tell them that there is an alternative medicine that will work for them?
Those who are struggling with fat is not my area of expertise, but those many people that are struggling with moles, with aesthetic problems and skin defects can and should contact me. Doctors sweepingly across the board in the whole world make a lot of money. They cut and cut and cut. People end up with scars and defects and frustration. I came up with a way to get rid of the spots in a more gentle way, an aesthetic way that does not cause pain and, most importantly, does not cause scars.
Wow.
A lot of people came from all over the world because it seems it is not only the formula I have developed, but specifically the technique that I developed, specifically the hands, and specifically the thoughtfulness I give to each patient. Anyone with internet can now visit our website, www.hpdermatology.co.uk, and click on the live expert chat, and they should be able to send us their photos and get advice in real time.
So this is what happened to you when you started being disgusted. All of a sudden, you took your life to a place that helps, eases, and brings mercy to people.
Exactly.
Can you tell me something about you that no one knows?
When I moved to Israel in 1972.
From where?
From the USSR. I finished at the University of Moscow in 1966. Most of the people that learned with me left to Australia and USA, and most of them had ended their lives in a strange way. One died young. One was injured very severely, as if there is a curse haunting our group of graduates, and I think that I was fortunate enough to be chosen by God to serve and cure people, and I think that is why He keeps me alive.
It's very interesting what you're describing. We've had on our show a graphologist that has talked about destiny and fate, and about whether people can get to or run away from their fate. I can see the expression on your face, and I want to tell you 3 things. First, thank you. Second, I would like to have your mobile number so that we can post the responses we get on the social networks. Third, an invitation to meet again, wholeheartedly because you have so many insights that I would still like to very much explore.
Thank you.